Medicare is incredibly confusing. All the plans and the letters and the parts. On one side, you've got Medicare supplement plans, or Medigap plans, so confusing they had to give it two names. And on the other side, you've got Medicare Advantage plans, and those late night TV commercials telling you how great those are. After getting thousands and thousands of comments on my other videos, it was time for me to make a video about the basics of Medicare. So grab a cup of coffee, sit back and relax, and get ready to become an expert. So what is Medicare? Well, Medicare is a federal program put up by the United States government to provide health coverage and prescription drug coverage for people age 65 and older. If you're younger than 65 and on disability or perhaps have end-stage renal failure, you can also qualify for Medicare. But I'll be discussing each one of these topics in detail, so be sure to watch to the end of this video. My name is Russell Noga. I'm the owner of Medisupps.com, and after 11 years in business and helping over 10,000 people with their Medicare supplement insurance, I want to thank you for clicking on this video, and I'm going to make this as easy as possible for you. Now, Medicare is made up of various parts, and this simply means who pays what bill for you. Those parts are designated in letters. Those letters are Medicare Part A, Medicare Part B, Part C or a Medigap insurance plan, and Medicare Part D. Now let's briefly discuss what each part of Medicare covers. Medicare Part A. This is hospital insurance. Part A covers things like inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Medicare Part B. This is what you'll be using the most of as it covers doctor's visits and outpatient procedures. Part B covers things like doctor services, outpatient care, medical supplies, and preventative services. Then there's Medicare Part D. This is a prescription drug coverage plan that goes along with original Medicare. Now there is also a Medicare Part C, which is a Medicare Advantage plan. You would have that or a Medicare supplement plan that would go along with original Medicare. I'll be covering both of these a little later in the video. So you start out with Medicare Part A and Part B, which is also called original Medicare. Now remember, Part A is hospital coverage and Part B is your doctor's services. Now those don't cover all of your medical bills. There are deductibles as well as coinsurance to pay. That's where things like a Medicare supplement plan or Medigap plan come into play, or some people choose to opt out of Medicare and enroll in a private Medicare Advantage plan. So I'll talk about Medicare Advantage plans first. Again, these are managed care plans, private plans that you opt out of Medicare and enroll in one of those. They then will cover at a minimum what original Medicare covers. Those are the rules. These plans have networks, so you have to find a plan that's actually in your area and a network in the area, and then you must use doctors on the list to get the full coverage from the plan. Now, beyond what they cover, just original Medicare, they can choose what they want to cover above that. Many of them do include prescription coverage inside the plan. Some don't, though. So Medicare Advantage plans can either be HMOs or PPOs or what's called private fee-for-service. One important thing to remember is that you still must pay the Medicare Part B premium each month for enrollment in a Medicare Advantage plan. In fact, I just had a woman call me the other day. She said, Russell, I swear I pay nothing. It's a zero premium plan. I don't even pay the Part B premium. And I had to remind her that it's actually coming out of her Social Security check. She later checked and realized that it was. So out of sight, out of mind. But if you do enroll in a Medicare Advantage plan, do keep in mind you still must pay the Part B premium. So just to recap again, there is original Medicare, which is Part A and Part B. And then Medicare Part C, you would opt out of original Medicare, still pay the Part B premium, and enroll in a Medicare Advantage plan. Let's talk about some of the pros and cons of the Advantage plans. Well, some of the pros, again, is that it could include prescription drug coverage. But this might not be the best thing. There are many different drug plan companies out there with different formularies. They can get different medications for different rates. With a Medicare Advantage plan, if you do enroll in one, you are stuck with that drug plan. If you take a lot of high dollar brand name drugs, this could get you into real trouble, and that zero premium per month on the plan might not look so good if you have thousands of dollars worth of copays on your prescription drugs. Now, that's not all cases, of course, and maybe there's a plan out there that will fit your needs just fine with the prescription drug coverage built in. Some of these Advantage plans also include additional benefits such as dental and hearing. And another pro might be the very low premium. As I mentioned, they do offer $0 premium Medicare Advantage plans. Again, you need to check the fine print on the coverage and to see which doctors are available in your area. So that brings us to what would be considered one of the cons of a Medicare Advantage plan, and that is you have to stay within their network. You do need a referral to go see a specialist as well. So if you travel a lot or you're RVers and you want to go around the country, you're out of your network at that point. Whereas if you stayed with original Medicare and a Medigap plan, you have the flexibility of going to any doctor or specialist anywhere in the country as long as they take Medicare. Now, one other point to consider when it comes to a Medicare Advantage plan, and this comes up a lot, is the fact that they don't always pay your claims. Again, don't forget, they only have to provide as good a coverage and what's covered under original Medicare. Though beyond that, it's up to them. And I will tell you, we get the calls at the end of every year during the annual election period where people can switch, begging us to take them off these plans because their max out-of-pocket costs were very high during the year, and they didn't realize that a lot of things weren't even covered. So let's discuss how to avoid that, and that is by enrolling in a Medicare supplement plan. Now again, back to original Medicare, remember everything starts with that. We have Medicare Part A and Part B, and there you would add in a Medicare supplement or Medigap plan. They're called the same things. Medicare supplement plans are designed to help pay most or all of the gaps or expenses that are not paid by original Medicare Part A and Part B. So let's talk a little bit about the differences in the Medicare supplement plans. Now we're back to the letters again. I told you in the beginning it might be a little confusing. Keep in mind these are plans, Medicare supplement plans, not parts. And it's okay if you confuse it. We hear it all the time. One of my clients called me the other day. She said they should have made them numbers, not letters. I agree. Probably would have been easier. But let's talk about the different popular Medicare supplement plans. And again, they are lettered. The most popular Medicare supplement plans are Medicare Supplement Plan G, Medicare Supplement Plan F, and Medicare Supplement Plan N. So probably the most asked question that we hear here at Medisupps.com is, what's the most popular Medicare supplement plan? Well, it's going to be Medicare Supplement Plan G by a long shot. Now, that doesn't mean we shouldn't look at the other plans, and we certainly will. I'll go into those in detail here. But Medicare Supplement Plan G offers great coverage, and you simply have to pay one small deductible. Let's talk about what a deductible is. It's very simple. Just a certain amount of money that needs to be paid by you typically before insurance will kick in and begin paying their portion. So the deductible that you'll need to keep in mind is the Medicare Part B deductible. Again, that's doctor's services. Now, Part A has a deductible as well if you go into the hospital, but all the Medigap plans I already mentioned, Plan F, G, and N, pay that for you. So Part B deductible is the one that we're going to be focusing on. Now, that's a once per year amount that you would pay prior to Medicare Part B beginning to pay its portion, and then your supplement would come in and pay the difference. So here's a quick example of how that deductible would work. Mary enrolls with Medisupps.com and gets a Medicare Supplement Plan G and pays $102 a month for the supplement. Her coverage begins on January 1st. Mary goes to the doctor on January 5th, and the total bill is $298. Well, in 2020, the Medicare Part B deductible is $198. This means Mary will owe the first $198 of this bill. After that, Medicare and her supplement plan will pay the rest. The deductible is what you are required to pay before your insurance starts paying. So the reason why Medicare Supplement Plan G is the most popular plan is because you only have that one expense, which is the Medicare Annual Part B deductible. Like Mary, she paid $198. For the rest of the year, she didn't have to pay a dime for any of her approved expenses. So to recap, with Medicare Plan G, you would pay your monthly premium to have the plan. Now this premium varies by region and a couple of other factors. So give us a call at 888-891-0229 and we can go ahead and find out how much Plan G is for you in your area. You would also pay the once per year Medicare Part B deductible. Now in 2020, this deductible was $198, but it will be slightly higher in 2021. Once you pay the deductible, you will get 100% coverage for all of your Medicare-approved expenses for the rest of the year. So the next most popular plan behind Plan G is a Medicare Supplement Plan N. Plan N is very similar to G, but it has a few additional out-of-pocket expenses. But the premiums for Plan N are much lower than G, so it makes it worth looking at. Now, with Medicare Supplement Plan N, it's very similar to G in that you still pay the Medicare Part B deductible each year prior to Medicare and your Plan N paying the coinsurance. Now, the difference is with Plan N, after you meet that deductible, you might have a small copay per doctor's visit throughout the year as you continue to go. Now, the copay will never be more than $20. In fact, it could be less, or there could be no copay. It just depends on how they code the visit. As well with Plan N, if you visit the emergency room and you're not admitted, there will be a $50 copay. So while hearing about Plan N and some of these possible additional costs you might have, you might be saying, I just want to go with Plan G. And that's fine, you could. That's why Plan G is the most popular plan. However, there are some benefits to Plan N that we should look at and you should consider. One of them being that the monthly premium for Plan N is always less than Plan G. For people who are healthy and never go to the doctor, the savings could be substantial by going on Plan N rather than Plan G. Another thing is, each year, Medicare Supplement Plan N has consistently had lower annual rate increases over Plan G. Every single company, as well as every single plan, has rate increases each year. Sometimes it comes in zero, but I'm just going to give you a heads up. You're probably going to get a rate increase. We watch those rate increases for our clients each year. You never pay us a dime. Our clients pay us nothing directly. It's all free. But we watch the rate increases every year, so you don't have to, and we shop the market. With Plan N, historically, it has always had lower rate increases than Plan G. Now, if you are somebody who does visit the doctor quite a bit throughout the year for various ongoing procedures, Plan N copays might add up and it might not be worth it. In that case, Medicare Supplement Plan G might be the way to go. Allow us to check the rates though and do the math and see which plan is going to be better for you. So just to recap with Medicare Plan N, you do have the Medicare Annual Part B deductible to meet each year, just like you did on Plan G. Once that's met, on Plan N, you might have a small copay per doctor's visits each time you go for the rest of the year. However, that copay will never be more than $20, and you might not get a copay at all, or it might be less. It just depends on how they code the visit. Now, another thing to consider on Plan N is that if you visit the emergency room and you're not admitted, you will get charged a $50 copay. This is just to keep people out of the emergency room for things like the sniffles. Another thing on Plan N to consider is that it does not cover what are called Medicare Part B excess charges. Now, I will tell you, after 11 years in business, I have never had a client get an excess charge. These are extremely rare and not something to worry about at all. However, I do need to tell you about them. What excess charges are is if a doctor does not accept what are called the assigned rates from Medicare, they can charge up to 15% extra. Now, it's estimated that over 97% of the doctors in this country do take the assigned rates. So again, it's probably something you will never see. There are some states, however, that are not allowed to even charge excess charges. So if you're in one of these states, it's another great reason to consider Plan N. The states that are not allowed to charge excess charges are Connecticut, Minnesota, Ohio, Pennsylvania, Rhode Island, Vermont, Massachusetts, and New York. So the last plan we need to talk about is Medicare Supplement Plan F. Now, if you were eligible for Medicare on January 1st, 2020 or later, you're not even allowed to enroll in a Plan F. They have removed it for new beneficiaries. If you were on Medicare prior to that and have a Plan F or are wanting a Plan F, you can still get it. I would highly advise against this. Plan F is Too much money for too little benefits, and it has higher rate increases now because it's a closed plan. Now keep in mind that the only difference between Medicare Plan F and Plan G is that Plan F pays the Medicare Part B deductible for you. And in 2020, this amount was $198. However, if you do have a Plan F, you're probably paying $300 or more extra dollars a year just to have the plan to get a $198 benefit. So that is money down the drain as far as I'm concerned. You can write the check yourself on a Medicare Plan G and save a substantial amount of money in premiums. So Medicare Plan G is definitely where you should be looking if you currently have a Plan F, and we can help. So just to recap the benefits of Medicare Plan F, anyone who enrolled in Medicare on January 1st of 2020 or later, or anyone new coming to Medicare if you're just turning 65, cannot get a Plan F anyway. You would pay your monthly premium for the plan just like you do all the others, and you'd get 100% coverage of all the gaps in Medicare if you have a Plan F. However, it does have the highest premiums of all the plans, it's got the highest rate increases every year of all the plans, and you would save a lot of money by going with Plan G and just paying the Part B deductible yourself. Now, if you do have a Plan F or you are considering one, please give us a call. At least let us check the rates and help you see how much you could save by going with Plan G. You can call us direct at 888-891-0229. There are some very important things to remember when we're talking about Medicare supplement plans. Number one is that every single insurance carrier has the exact same coverage within each plan. This means a Plan G from one company is identical coverage to Plan G with another. Their premiums, however, are all entirely different. That means one company could charge $110 for Plan G, and another company could very easily be $170. Now, what we do here at Medisupps.com, we are independent agents. We shop all of the rates from all the top companies for our clients, and then make sure you get the lowest premiums with the best company. Another thing is that these companies all have rate increases every year. That means regardless of where they start, they're all going to go up. So we watch those rates for you so you don't have to, and you never pay us a dime for our services. So that brings us to the last part of Medicare, which is Medicare Part D. This is Medicare prescription drug coverage. Not quite as easy to choose a plan as, say, the Medicare supplements, and where we only have a few popular plans. This is because there are many, many different drug plans available in your area, and they all have different premiums. Now, the number one tip I can give you when it comes to choosing a Part D drug plan, if somebody recommends one out of thin air without asking you what medications you take, run for the hills. Because with all of the different plans available and all the formularies, each insurance carrier can get your specific medications for a different price than another carrier. That means your neighbor might say their plan's great, but that's based on what they're taking. So you need to look it up or have somebody like us help you. We don't sell the plans, but we make sure all of our clients get in the right drug plan because it's very easy to overpay. Now, as I mentioned earlier, when it comes to Medicare Advantage plans, your plan might actually have prescription drug coverage built in. But if you're staying with original Medicare and a Medicare supplement plan added in, you will need to enroll separately in a Part D drug plan. Now, many people ask us, well, gee, I don't take any drugs. Do I have to enroll in a plan? No, you don't. But unfortunately, the government's going to assess a penalty if you finally do enroll in a plan one day. So a lot of people will just get a low-cost plan at that point, and you have one if you need it, and you'll avoid the penalty as well. Now, Medicare Part D drug plans can be changed only once per year, whereas a Medicare supplement plan can be changed anytime during the year. You do not have to wait until that annual election period, which happens October 15th through December 7th every year. But with a drug plan, you do have to wait until that time. If you want to make a change on a drug plan during that time, your changes will go into effect January 1st of the following year. If you are just turning age 65 now, you would simply enroll in a drug plan and the coverage would begin the same day that Medicare and your Medicare supplement plan begins as well. So those are the many parts of Medicare, as well as a description of the different Medicare supplement plan letters that are the most popular. Now, this brings us to the most frequently asked questions that we get here, and that might be some of your questions as well. Why do insurance companies all have different rates for the same Medigap plans? That's a great question. Now, insurance carriers do in fact have different rates for the same Medigap plans in your area. And this is why people love our service, because we simply shop all of the rates every year for our clients to make sure you don't overpay. It's extremely easy to do that. In fact, everybody we switch who comes to our website and wants to get quotes for another plan finds out that they were paying too much for that same Medigap plan already. And again, we do this for our clients every year. We never let you get to that point with our annual rate review. We make sure that you're always paying the least amount possible. How much do you charge? Another great question. We don't charge anything. We simply get paid by whatever insurance carrier you go with. And we don't work for them. We work for our clients. Now, I will tell you, if you go direct to an insurance company, they're never going to tell you the rates with other companies. They just want to sign you up with them. You would pay the same whether you go direct or not. So it's a no-brainer using our service because it's free and we watch the rates for you every year. But we check from all of the top companies to make sure that you don't overpay. If I want to switch companies in the future, do I have to get approved? If you're looking to change Medicare supplement companies in the future to save money, which is why most people do it, then yes, you will have to answer medical questions on the application. They're not as stringent as you might think. We do this probably 10 times a day for people to save them money. But you will have to answer the medical questions and then get approved. Now, many people ask me, Russell, what if I have a condition and I'm stuck and it's a major medical condition, something serious, and I can't move? In that case, I say, congratulations, you have outstanding coverage. Just focus on getting well, not saving $10 a month on your premium. So, but if you do want to change, yes, you'll have to answer the medical questions, but no, it's not as hard as most people think. I'd like to change from a Plan F down to a Plan G and save money, but will my doctor accept the Plan G? Absolutely, your doctor will accept Plan G. Keep in mind, Medicare is a federal program and Medicare supplements just follow Medicare wherever it goes. Therefore, you can use your coverage anywhere in the country, whether it's a Plan F, G, and any Medicare supplement plan. All you have to ask is if the doctor accepts regular Medicare, and in that case, they'll take your supplement plan. Keep in mind, Medicare supplement plans are not like Advantage plans where you have a network. How much are the rate increases each year? The fact is, we don't know what they're going to be next year. And that's why we watch it for our clients every year. In fact, I just signed a woman up just prior to making this video. She's out in Ohio, and she said that another agent called her and told her that the rate increase was only going to be 3% next year. Folks, if you hear this, again, run for the hills, because no agent and not even the insurance carrier can predict what their rate increase is going to be next year. They simply don't know. So we check it every year because we don't know, and we make sure that you're always paying the least amount possible. And again, you never pay us a dime for what we do. So that about wraps it up for this video. My name is Russell Noga with Medisupps.com. I hope you enjoyed it and it helped out. With any other further questions you have, please give us a call. We're at 888-891-0229. We can answer any of your Medicare questions and also get you signed up with Medicare supplement insurance as fast and as easy as possible. Or feel free to visit Medisupps.com where you can get free online quotes. Don't worry, we never sell information. There's just a couple of us here and we're not going to bombard you with phone calls. Have a great day, stay well, and stay healthy.